Hello, my name's Jo Murphy. I've been a GP since 2006 and it's great to speak to GP colleagues about Buteyko breathing technique. I came across this technique myself a few years ago when a patient enthusiastically told me that it had helped her asthma symptoms and I'd never heard of it. So I did what we all do and Googled it after surgery. I tried it out myself and eventually I became interested enough to go on a teacher training course. I'm going to talk about some of the current research, including availability, limitations and quality of current research. I'll signpost you to some sources of evidence and guidelines around Buteyko breathing technique, and I'll reflect on how this evidence has impacted on my own confidence to mention Buteyko in GP consultations with patients. I'll talk about some research limitations first. Studies do tend to be quite small in terms of participant numbers, especially in primary care. I think because individual teachers are often busy clinicians who see a small number of patients for Buteyko, and so large studies are logistically tricky to organise. The studies are often single-blinded RCTs because the Buteyko teachers will know whether or not they're teaching Buteyko, and so can't be double-blinded. The control group can also vary. Sometimes control groups receive no intervention, and sometimes the control group in fact receives key aspects of the Buteyko breathing technique package, such as repeated tailored asthma education. Despite these limitations, BTS found that the accumulation of consistent findings in certain research areas over multiple studies allows us to speak of modestly improved symptoms, modestly improved quality of life, and reduced reliever usage with confidence that the evidence for this benefit is of high quality. Modestly improved symptoms might not sound very much, but I do wonder if it might make the difference, for example, in whether somebody's being woken at night repeatedly by a dry cough. You'll find references to the BTS guidelines and the GINA guidelines and some other research studies on the BBA website under the research and guidelines section. And if you want to do your own research, I'd recommend using Buteyko breathing, dysfunctional breathing as search terms, and perhaps also looking at mindfulness of breath research. I think it's worth dipping into a few other study examples to give a flavour of the kind of studies that are out there. The first example that I've chosen is by Robert Cowie. I chose this because it's a slightly larger but otherwise fairly typical Buteyko study. In a single-blinded RCT, 129 participants were randomised to Buteyko or to physiotherapist-led asthma education and gentle breathing. These are key aspects, in fact, of the Buteyko breathing technique package, so we might expect to find fewer differences in the groups. And in fact, quality of life and asthma control improved significantly in both groups. In the Buteyko group, the number of patients with control of their asthma increased from 40% before learning Buteyko to 79% after learning the technique. In the Buteyko breathing technique group, but not the control group, over the 6 months follow-up, there was significantly reduced use of inhaled corticosteroid and reduced use of inhaled long-acting beta-agonists. There were no adverse effects or increased exacerbations over the 6-month follow-up. A second example study is by Patrick McHugh. I've chosen this one as an example of one of the many small single-blinded RCT studies of Buteyko you might come across. You'll see there are 38 patients, and again, the control group included equal clinician contact time and asthma education. In the Buteyko group, there was a reduction in reliever usage by 85% versus 37% in the control group. And inhaled corticosteroid was reduced by 50% in the Buteyko group and was unchanged in the control group. FEV1 was unchanged. Again, there were no adverse effects. I should point out we wouldn't say that Buteyko breathing technique training results in a likelihood of being able to reduce inhaled corticosteroids, as the studies are not consistent overall in this area, and these are just two examples. You'll find a number of other similar small studies, some of which investigate the physiology behind the technique, some research-specific research questions like nasal symptoms in asthma or sleep apnea, and I'd love to see more studies on panic disorder. An important point is the research indicates that Buteyko is not a cure for the underlying pathology behind asthma or airways hyperreactivity. Looking at the studies, lung function tests are generally not improved in research, even if symptoms are. I've looked carefully for adverse effects in the studies. I couldn't find any, despite patients often cutting down on medications. Study follow-ups are often 6 months long, and studies have been published over the last 20 odd years, and I feel happy to tell patients this is a safe technique. It crosses my mind to mention Buteyko in general practice. I first of all labour that there is this technique out there that's safe, but takes a lot of practice. The gains might be modest, and the technique's not a cure. And if I find that patients still want to learn more after hearing all of this, I would then personally suggest that they look online, perhaps at a website like the BBA or another big Buteyko teaching website, and get back to me if they still want to find out how to go ahead, or perhaps contact a teacher directly. I've enjoyed learning and sharing Buteyko breathing technique with patients and found it helpful. And I think perhaps group consultation teaching, such as the groups that are increasingly running nurse-led groups for diabetes and chronic disease, could get around the time constraints of teaching Buteyko in primary care. If you're in a part of the country with no NHS availability of Buteyko teachers, some Buteyko teachers offer private lessons online, and there are research studies which indicate online or video lessons can be effective, and I know people are starting to develop apps for Buteyko teaching. Thank you.